While Indiana has seen more than 12,000 deaths from COVID-19, cases, hospitalizations, and deaths have declined to numbers not seen since last summer. And the majority of counties in the state are in the blue range, with positivity rates less than 5%. And joining us now to talk about the pandemic is Graham McKean, the Assistant Director of Public and Environmental Health at IU. Hello, Graham. Been a year since the pandemic began. Do you have any updates for us right now?
The best update I have is, the vaccines are coming and the supply is going to really cascade here the next few weeks. And we are getting really excited here locally as we're partnering with Monroe County, and we're going to transition their vaccination site for the community to Assembly Hall starting March 29th here in Bloomington, and really hope to be able to expand capacity and increase some of the vaccine uptake in the area.
Do we know yet about how long the vaccines will provide protection against the virus? Is this going to be something like the flu where you get a shot once a year, or is it too early to know that?
I think it's too early. It's still, unknown at the moment, simply how long this immunity lasts, because we only have a few months of really solid data. That data is looking really good so far. So, at least a few months of really strong response, and I anticipate much longer, but likely not a lifetime. I think the fact that the CDC's new guidance for fully vaccinated individuals, they removed any reference to time period, which is promising. And they, appear effective enough against variants so far. And all of them essentially guarantee you that you will not be hospitalized or die from COVID-19. And so we have some studies looking at booster shots of the existing vaccines. We also are tweaking formulas of the existing vaccines to be more effective against those variants. And honestly, we're just getting a lot of really great real-world data now from places like Israel. One study from just 2 days ago for the Pfizer vaccine that showed 94% protection from asymptomatic infection, 97% from symptomatic. So they're amazing. They're amazingly safe, and they have great safety profiles. And everyone should certainly get one. This is their only way of going forward.
Just have about 30 seconds left. There's talk of another wave coming due to the variants of the virus. So do we still need to be vigilant?
Oh, yes, certainly need to maintain that vigilance for now, but we are getting this home stretch. But we also need to realize that we still have over 50,000 cases and over 1,500 deaths per day of this virus in the United States. We had nearly 1,000 cases and 30 deaths in Indiana today. And this is with a decent chunk of folks previously infected or now vaccinated. So we have to continue those measures for now in the near term. And this plateau, this slower decline, that might be what we're seeing with these variants now. You might see some continued plateau, maybe some slight increases, but I personally don't think we're going to have another massive wave of this virus because of this arms race between the vaccines and the variants.
Thank you very much. Appreciate your time.
Thank you, Joe.